Hello, and welcome to Winnebago County's Health Department TV show, where we talk about public health and connect it to your health. Today I have some guests here to talk about refugees. So why don't we go around and introduce yourself and where you work.
I'm Kathy Schultz. I'm the Health Navigator for World Relief Fox Valley, the Refugee Resettlement Agency here in Oshkosh.
Okay.
And I'm Jane T-Bon, a public health nurse that works with refugees.
And I'm Risa Sankari, an AmeriCorps member at the Winnebago County Health Department.
Well, thank you all for being here. We're going to jump right in, and I'm going to ask you, Kathy, to start explaining a little bit about refugees in general. What is refugee?
Well, I think the most important thing for people to know is that a refugee is not the same as a migrant. Refugee is a very specific kind of a migrant. Refugee is somebody that has been forced to flee their country because of fear of persecution or death, war or violence. And a refugee has a well-founded fear of persecution or death related to either their race, their religion, their nationality, their political opinion, or their social affiliation. And just because you fled your country doesn't automatically qualify you as a refugee. The United Nations High Commission on Refugees is the agency, the international agency, that must determine whether somebody qualifies for refugee status.
Okay. So what are the numbers like? How common is refugee status?
Well, currently there's more than 25 million people worldwide that are officially registered as refugees. They have had to flee their home country and go to sometimes a neighboring country, sometimes a country a little bit farther away. And of the 25 million people that are classified as refugees, more than 10.5 million people are in actual refugee camps right now. Only less than 1% of all of the refugees worldwide are actually resettled into a third country like the United States or Canada or Sweden.
So you mean 99% are still waiting to be resettled?
Yes. So you can see it's a global problem. It's not something that we can solve quickly. And of course, the best thing would be to solve the problems that are causing people to become refugees, to stop the war and the violence and the persecution. But until that happens, we need to deal with the fact that we have so many people that are displaced worldwide and cannot go back to their home country, so they need a new place to live.
So when you say they're displaced, where are they in the interim before they're placed?
Well, most of them are in a refugee camp, or they may be living within a city in a neighboring country. So sometimes, like, people from Iraq might flee into Jordan or to Turkey, and sometimes they'll be in a refugee camp. Sometimes they might just be living within one of the major cities, but they still are refugees, and they're still not able to stay legally within that country and become a citizen. They're just there as a kind of a temporary status. So they're seeking placement in a country like the United States that will allow them to resettle and become citizens eventually and start a new life.
Okay. So we need organizations to help with this process, and here we have World Relief. Is that unique to the Fox Valley? Is this a national, global organization?
World Relief is an international organization. In the United States, World Relief specifically just works in refugee resettlement. Nationwide, we work, or internationally, we work within other countries to help them with various things, not necessarily related just to refugees. But in the United States, we just do refugee resettlement work.
Okay. And the Fox Valley World Relief, you guys here cover what region?
We settle refugees in Oshkosh and Appleton primarily. Right now, we're just working these two communities. The main limiting factor is really the access to public transportation. There are a lot of smaller communities in the area that might be interested in hosting refugees, but since they come with little or no resources, access to public transportation is really key. So we try and settle our clients in the two main communities where they have access to the bus system.
And how long has World Relief been in the area? How long have you guys been working
Here
here?
with Stephanie from the Winnebago County Drug and
office
Alcohol
has been
Coalition.
open since
Stephanie?
the beginning of 2012, And in the 5 years that we've been open, we've already resettled 730 refugees in the Fox Valley.
Wow, that seems like a lot. Is it projected that the same amount of numbers will keep coming?
Well, it's hard to say with the new immigration orders that the current administration has issued, but the first couple of years that we were open, we resettled about 90 people each year. Last year in 2016 was our biggest year. We had 209 clients that we brought in. We were anticipating having about that number this year, but because of the change in the administration, our numbers are way down. We've only brought in 80 people this year, and we're hoping to have a little over 100 if things go according to plan.
Okay. And when refugees are resettled to Wisconsin, what country are they coming from?
In the Fox Valley, in our agency, we work primarily with people from the Democratic Republic of the Congo, Burma, Iraq, Syria, Pakistan, and Afghanistan.
So not a very English-type countries, and probably a lot of a transition.
Yes, it's a big transition for all of our clients, and that's a big part of what our agency does, is getting the clients connected to existing communities, getting them connected to resources, English classes, job training, all the things so that they can become independent and self-sufficient as quickly as possible.
Okay, so as you've kind of alluded to, there's a lot of working parts in how someone transitions, and we have Jane here to talk a little bit about that healthcare aspect, and you can still chime in on plenty of the details. But Jane, when someone comes here and they need to get up to date with our healthcare system and perhaps where they're coming from, the different vaccinations, just give us an overview of how the public health department can help with that.
Okay. Healthcare is very critical for a successful resettlement for refugees. Many of them have chronic conditions that were not diagnosed overseas. So they've been living with conditions not treated. So here they can be diagnosed properly, treated, and managed so they can successfully go to school and work and transition to their new life.
So you're a public health nurse, and part of your role is to help with this?
Right. So what we do is shortly after a refugee arrives, we meet with them in our office to go over their health history, current problems, current medications, and we teach them about the health system, what to expect when they go to the doctor, and get them familiar with what screenings are going to be done so when they go they're not surprised on what happens. And then we also communicate with the physician before they go, which is important. So they know their history, they know what ailments they may have, and then they also know what screenings to do. Okay, and then when screening results are done, they get faxed back to us at the health department. So if there's a need, we do have the refugee come back to see us if we need to explain something that is worth explaining.
Okay, and why is it so important that we're part of this transition? I mean, I think the prevention is kind of the obvious aspect, but why is public health needed in this transition?
Public health is very important. We play a few different roles. We provide education to the refugees so they can understand our Western medicine. It's a lot different than what they're used to. They're used to going to a doctor for an urgent need and getting treatment, and that's it. Here we have preventive care, we have vaccinations, we have annual exams. So it's a whole different concept to a refugee. They may not see the importance of that right away. So that's important for them to understand how we kind of do business here, and that we have a pharmacy and you can purchase over-the-counter medicines for simple things like a headache where they may not have that opportunity before.
So it sounds like getting them used to the different medical philosophy we have here might be one of the barriers, and you also listed a couple other barriers that we kind of have to overcome right away. What are some of those? Yeah,
language is the main barrier, whether it be spoken language or body language. So Obviously, many of them don't speak English, so we at the health department and physician offices always use an interpreter. Very important that the interpreter and the refugee understand each other, and there's many different dialects, so that's important. Body language is important because what we do, for example, nodding, may not mean yes to them, so, or vice versa. When they nod, it may not be yes. So understanding their cultures is important.
Well, thanks for that overview. And I mean, just all the working parts, it seems like we have a lot to learn. And Yesra, I asked you here to kind of help us understand a little bit more about what this process is going through and what our community is trying to support to make this transition easier, make us a little bit more welcoming here in the Fox Valley.
Sure. Okay. So my experience with refugee families started pretty much the beginning of 2016 when my former teacher at Merrill Middle School reached out to me and asked me to help out with a refugee student who was having a hard time transitioning into like the American schools. And she thought that I'd be a perfect person because I was in her shoes like 15, 16 years ago. My family was not a refugee family, but we did immigrate a while back, and we did have the same kind of culture shock and the struggles of language barriers. So I kind of started helping out once a week with that. And then pretty much soon I started to help out with a few refugee families with kind of translating documents and setting up some appointments and pretty much doing all kind of little things here and there. Just to kind of help them transition. And there's a lot of other individuals in the community that do very similar things, especially at local churches and even the mosques that are here in the community. One other thing that our community is doing is the Sociology department at UW Oshkosh. There's a professor there, Dr. Van Auken, and I'm working with him on this research project. And this research project is pretty much, we're interviewing some of the refugee families, and we're asking them simple questions like how did you come here? What was the process like? What are some things that happened that made you successful being here? And what are the local organizations that are helping you, and how are they helping you? And are there any gaps, or should we have any improvements on that? So this is kind of one way that the community is helping out, just to make sure that they later on have a better experience, or at least for refugees that are hopefully going to come later on, have a better experience once we've finished that research project and get that all done.
Great. Well, it sounds like there's a lot going on, and it's definitely a complicated process, but thank you all for coming and joining us to share a little bit today. And if you want some more information, you can go to www.worldrelieffoxvalley.org.